So Michael, owner of Active Answers Health in Seaforth, and yeah, so today's it's our first workshop, I guess, and it's going to be all about shoulders. And yeah, let's learn a little bit about the anatomy of the shoulder and like common injuries or do's and don'ts, and
yeah. Thanks, Joe. Yeah, we've been talking about this for a while, so it's good to actually do it. The reason we pick shoulders is I see a lot of shoulders. I have a swimming background and work with lots of swimmers, so swimming is something I see a lot, and obviously with swimming comes shoulder issues. So shoulder pain in the gym is also very common as well. As Jared said, I'm Michael, owner and physio at Active Answers in Seaforth. If you know Burn Street, you probably know the fabric shop.
Oh yeah.
Favorite, yeah, so we're right next door to there. Just across the road from Seaforth Soccer Oval as well. So yeah, we've got physios and exercise physiologists up there. I'll just stand on right. You guys see. So yeah, pretty much we're going to cover what causes shoulder pain, common injuries, why it happens, can you still train with shoulder pain. We'll go through some exercises and kind of common errors, tips and tricks, ways around it, and then we'll go through some questions as well. If you have questions throughout, please put your hand up and say it. But yeah, if you've got niggles or anything like that, we can chat about that at the end. So, quick rundown on the shoulder. Has anyone got shoulder issues, had shoulder problems? Yeah, most of us, me included. Just out of interest, so we can kind of tailor this, what kind of issues are they? Like a rotator cuff?
Yeah.
Yeah?
No idea.
No idea?
Yeah. Muscle maybe.
Yeah. Yeah. Like, do you get it in the gym, the pain?
No, many years ago I moved in a funny way and my shoulder really hurt. It's never really felt the same since, and a few years ago I was moving a desk and it felt like something tall.
Okay.
And so the sort of the hanging kind of motion there just really hurts sort of in here.
Alright, maybe we can use you as a demo later.
Does that mean I'm a model?
That's it. You made it.
Just.
So yeah, so the shoulder, I don't think this is going to work for there, no.
do it. The clicker.
Not on the screen.
Yes.
It just won't work on there. Anyway, it doesn't matter, I can reach. So yeah, your arm pretty much just attaches to your body by muscle. You've got it's a ball and socket joint, but it's just kind of hanging there. It's got the capsule, then you've got ligaments, and then we have our muscles. So it's a very, very unstable joint. And if you don't have good strength around the shoulder, that's when you run into trouble. Okay? So the first kind of layer of muscles is your rotator cuff. Their role, it's 4 muscles. It's one at the front, one at the top, 2 at the back. Their role is to work together to pull the humeral head into the socket. You then have your deltoids, which are the bigger muscles that surround it. So this is like your rotator cuff here. Your next layer is kind of your deltoids. And they're the muscles that we want to do the big movements with. If you don't have good deltoid strength, then you're going to use your rotator cuff a lot more, and that's when it gets overloaded. You then have your scapular muscles, so the muscles around your shoulder blade. Now these muscles are super important. They'll take a lot of pressure off the front. So I'm sure the trainers you tell you to kind of squeeze your shoulders back. When you're rounded, you can't engage the muscles at your back. All the pressure will go on the front, being a rotator cuff, being one kind of factor that suffers from that. So it's really important we use our scapular muscles, and we'll show you how later. Yeah, so super mobile joint, really important that we have good strength around the shoulder. The position of our shoulder blades is really important when we do lift, and thoracic mobility, so upper back, upper spine mobility is important as well. For instance, if I'm super rounded and I try and lift overhead, that's as far as I can get. If I then open up, I can get all the way to the back. So if you're, like most of us, sit all day at work, if you're then going into a session where you're super stiff and you try and do overhead exercises, that's when you probably run into trouble. Because instead of pushing up here, we're slightly rounded, we're pushing forward, all the load is now going to the front. So it's a really important factor as well. And one, again, we'll touch on in a bit. Does that make sense? All right, you've all done your anatomy course on shoulders. So common causes of shoulder pain, there's many more, but these are probably the more common ones. Rotator cuff tears and rotator cuff tendinopathy. So when we look at rotator cuff tearing, after the age of 50, like 30 to 50% of people will have a rotator cuff tear. It's kind of just what happens when you get older. It's like the wrinkles on the inside, okay? So most people with tears are asymptomatic though. Like if we scanned everyone in this room, half you probably have a tear in your shoulder and don't even know about it. So it's not something we have to panic about. It's just, you know, they're there. Tendinopathy, so obviously the tendon, so where the muscle attaches to the bone, that's called the tendon. Doesn't have great blood supply, so it doesn't like any change. So change in load. So if you've gone from no gym to 5 sessions a week, the tendons are often the ones that are screaming, you know, what are you doing? So yeah, it used to be called tendinitis, which is an inflammatory issue. Now it's tendinopathy, which encases all inflammatory conditions and non-inflammatory conditions. The bursa, anyone been told you have bursitis before? Yeah, so it's a sac of fluid that generally sits between tendons and bones. When you have an irritated shoulder, you almost always have bursitis. And it's this common thing that happens. You might go to the doctor, get an ultrasound. The ultrasound will show bursitis because you have a sore shoulder. Then you get sent for an injection. You get an injection, a cortisone injection into the bursa. Might help for a week, but it's not really solving the problem. So, yeah, it's something we see all the time in the clinic. And the bursa is not often the cause of the problem, it's just the result of the problem. AC joint, which is where your collarbone attaches to your shoulder here. Most injuries happen with trauma, so falling on an outstretched arm. If you've had an AC joint kind of earlier in life, you are more prone to an arthritic joint later. So if you then become weaker, you get a lot of kind of pain through there as well with overhead lifting. Anything that compresses the joint, it won't like. Frozen shoulder, not a gym injury condition, but one that we do have to know about in the gym because it will restrict your motion and it can kind of come on slowly. People think it's a rotator cuff issue, but yeah, it's not one you want to try and push through. And then you can have referred pain from your neck or your back. And yeah, so why it lingers, and this is one of my big kind of annoyances when treating shoulder pain, because people often come, 6 months, a year down the track after having pain. I mean, have you had your shoulder looked at?
Yeah.
Yeah, because it's, why, can I ask?
Lazy. I just really don't like doctors. Really, just say tough.
Tough.
Complete worse.
Well, it's one of those joints you can kind of avoid using it. So if it hurts up here, you just don't go up there and you use your other arm instead, which is why you can kind of get away with not doing anything about it for a long time. But the problem is, you avoid it, it gets weaker, makes the problem worse, and then just this cycle just continues to happen. And if we leave it for too long, it's really hard to then build the muscle up later. So it's one of those things that it's easy to get on top of quickly if you get onto it quickly, and you just don't want to leave it linger, because as soon as you lose the muscle, it's hard to then get on top of it. Yeah, most people only rehab to kind of out of pain. They don't actually rehab to the level that they need to get to. It's often why it's a recurring issue as well. So the main reasons it happens is overload, which I touched on before. So if you're doing too much training or too heavy weight, not enough rest, more than your body can handle, then that's when you'll get an irritation. And it's the same with, anything. And then technique can come into play. Not often the cause, and often bad technique is because we don't have adequate strength or we don't have adequate range of motion. So for instance, if we're trying to do an overhead press, like a strict overhead press, you need a fair bit of rotation in your shoulders to do that. If you don't have the strength to get in that position, again, you're going to be pushing forward, the weight's going to come forward, the pressure's going to the front of your shoulder. Is that anything anyone notices? As trainers, do you notice that?
Yeah, very common. I sometimes even struggle to
Name and shame.
Me? I sometimes struggle with that. That's why dumbbells is easier than a barbell.
Yeah, exactly. So if you're weak in those muscles, and again, we use your rotator cuff as an example. If you're weak in your internal rotators, these muscles at the back will get really tight. When they're tight, they will then limit your range even more. So we need to work on Sometimes we need to work on increasing the mobility first to then allow us to strengthen through your full range of motion, and then we'll start to really get the benefits. If you can only get to here, you can only get strong in that position. If we can then open your range to here, we can work through the full range, and you'll get, that's where all the gold is. And that's where people don't often get to. And that's why shoulders are so common. All right, we're all good? Any questions? So this is, when we look at overload, this is kind of what it comes down to. Our load versus our capacity. So the blue is the load. This is a nice AR generated picture I made. So yeah, blue's load, and load is everything you put through your shoulder. So it could be, you wake up in the morning, you take your dogs for a walk. I have 3, I'm looking after 3 dogs at the moment, so there's a lot of load on my shoulder. But, you know, that might be walking the dogs being pulled. Then it might be, I don't know, picking up your kids or grandkids as they move around, there's more load. Then you might go to the gym, that's another section. Then you might go to work and cook dinner, put dinner away, go to the shops, you know, all of a sudden your bucket's filling up. Everyone has a capacity. When you're in pain, your capacity will drop. As soon as the load goes above what your shoulder can handle, that's when you start to get pain. So when we're in pain, we need to know, you know, we need to be able to do less. We'll talk next slide about how we manage capacity, but other things will impact our capacity, like sleep. Sleep and nutrition are big too. If you're not getting enough sleep, your body's not going to be working at its optimal level, so our capacity is dropping down. Jared, go to bed. So this is really important, and this is pretty much the crux of most injuries, well, most things in life, you know, outside of injuries. But yeah, so it's all about what's our load, what's our capacity, and how we increase our capacity. So that in shoulders in particular, how we increase the capacity is strength. We get stronger, we can then handle a lot more load before we get pain. So the easiest way to measure what your capacity is obviously pain. You know, if you've got pain during a session or an exercise, then you're doing too much to what your body can handle. So we need to change things up there. We look at pain level during, but we also look at pain level the next day. So most tendons work on a 24-hour pain behaviour. And that's because tendons have a bad blood supply. They often you won't know they're sore until later. Has anyone noticed that? Does anyone have plantar fasciitis or Achilles tendinopathy or anything like that?
Yes.
And his first steps in the morning are awful, and then through the day as you move, it kind of gets better and better. That's the way tendons work. So that's why we have to monitor the pain during and after, and the next day. We do that, you know, with my patients with a pain and exercise diary. So I get the patient to write down everything they've done, so all their load, and then we put down the pain level out of 10. I can send you guys the pain diary if you want. And then we map it. So if you know you've done a lot today, tomorrow morning your pain is increased. Obviously the amount you did today is too much, so we need to drop that. Then we can work to a level that we're happy with, which is generally less than a 4 out of 10. Then we know how much you can tolerate. We stay with that for a while. As we build your strength, then we can do more and more and more. The other way we measure capacity is through strength testing. We use a dynamometer, which I've got set up over there, which we can have a look at maybe later. It gives objective data, so actually, I'll do it now. Yeah, well, Ming, if you stand up, just do it. So that little machine thing in the middle is the dynamometer, and it's got tension links on each end, so when you pull, it will tell you how much force is being pulled. So we can do lots of different positions for the shoulder, but like if you do an external rotation, you know, often we'll do an external rotation and then we'll do an internal rotation, and we get a baseline, and we'll compare left versus right. So if Ming's got a bad right shoulder, you know, and he's 50% weaker on his right than his left, then we know he can only handle 50% of his normal load. So when we look at the gym programming, we have to do a lighter weight, less reps, or work on other muscle groups. So yeah, that's a really, really useful tool, but you can do it in the gym setting. You know, I can't do 10 reps today. You know, I'm not as strong as I normally am. Change things quickly, don't try and just push through that pain. So yeah, this is talking about pain and pain levels. So definitely we want to keep training when you have shoulder issues. We just have to modify things. If you stop, this cycle will happen. You'll get weaker. Yes, the pain might get better with rest, but if you wait 6 weeks for the pain to go away, you've lost a lot of muscle in that time, and it'll be even harder for you to get back to where you are. Or you'll just start, the shoulder pain will happen again, and then you're not getting anywhere. So we do want to keep training. We just have to try and adjust what we do. So when we train with, this is mainly rotator cuff tendinopathies, but we can kind of put this into most injuries with the shoulder. You want to keep it below a 4 out of 10 during exercise, or no more than 2 pain points. So if you start at a 0 and it goes to a 4, that's not ideal. Like, depends on the person and how irritable the tissue is, but generally speaking, no more than 2 pain points higher. So if you start at 2 and it goes to 4, that's okay. If it goes from 2 to 5, no good. We need to back you off a bit. The pain should settle back to baseline after the session, and we don't want that pain to spike the next day. And if it does, yeah, we're modifying things.
Just a question on that. So you're saying that it's natural to have some underlying constant level of pain or ache?
Yeah, it can be okay. Yeah, as long as it's not spiking.
Right.
A spike in pain kind of tells us how irritable it is.
Yeah.
So if it's super acute and early on, it might be fine, and then you go and do something and it goes to an 8. It's like, no, we need to pull right back. But if it's something that's been there for a while, the only way out of pain for a lot of those instances is actually training through it to get it stronger, so it can adapt. So yeah, we can modify the amount of sets, reps, or weight we do. We can modify positions. So instead of doing a strict shoulder press, we can come in closer, changing grip. Scapular plane is the position that our shoulder blades sit. So it's about 30 degrees from 0. So it's an easier position on our shoulder. And then we can change the range of motion. So we just don't go to end range. We just do mid range for a while, and then we work more. And it's important that we build strength in the supportive muscles. So if I've got a long head of biceps issue at the front, I'm obviously not going to do lots of straight arm lifts, but I might do a lot of rows. So I'm getting the other muscles working nice and strong. When this settles down, then I can start adding that back in again. All right. Any questions on anything so far? Cool. So I thought, we could go through some kind of practical examples.
Actually, I have a question.
Yeah.
I don't have any shoulder pain, but how do you identify someone's pain threshold? And then how do you also know the difference between fatigue and when you're pushing yourself a little bit too hard, and then obviously you lose your form, and then versus injuring yourself. At what point do you differentiate?
Yeah, it's hard, especially when you first start working out. You often feel you get the DOMS, the delayed onset muscle soreness, and some people think that's an injury.
Yeah.
Generally speaking, if your pain is lasting more than 24, 48 hours and it's sharper, that's generally telling you shouldn't be there.
Yeah.
If it's only there for that kind of day or two after and then goes away and it all warms up with activity in the early stages, then it's generally just that kind of muscle soreness. Shoulder generally you'll know, but it's something like your back. If you've worked out your back for the first time, it feels like you have back pain.
Yeah.
Because every movement you do relies on your back muscles. So that's a super common one we see. And pain threshold is important as well. You see someone who's just really tough and just pushes anything and doesn't think they're injured.
Yeah.
And you see them walking like this. There's something wrong with you.
Yeah.
But some people are very hypervigilant onto everything. And it just as you do it more, you learn what your body's used to. Okay, well let's maybe move on to some exercises. Before we go into the specific examples, where's my band gone? Oh, there. You just pass the green, thanks. So the main, we talk about squeeze shoulder blades back a lot. It used to be once upon a time it was like shoulders back and down and lock them there. That's not the right kind of position we want to be in the whole time. Because if we lock our shoulders, we can't get proper movement. So the first kind of, should probably say as well, that your rotator cuff works hardest through from 60 degrees to 120 degrees. That's where most issues come about with rotator cuff. So if you've got pain like up the top, often it's something else, but through the middle it works the hardest. If you're not using your shoulder blade muscles properly, then you'll get load here. So and this is a warm-up exercise I'll show you later, but we can go band, shoulders back, then you initiate the movement. So this can apply to any movement really. Initiate the movement, then you start the movement, but then you get to a certain point where you need to kind of let your shoulder blades go through the full range to get to the top. And then as you come back down, you're kind of initiating your shoulders as you come down. Does that make sense? So it's set, start the movement. If you're doing a full range, you've got to let the shoulder blade go, and then it's initiating before you come back down. So we're gonna talk about that through a few different exercises here. But if you've never done that movement before, it's quite an awkward one. Like you don't want to go back and down. We actually want your upper traps working a little bit with a lot of gym exercises because we need the shoulder blades to upwardly rotate, and your upper traps do a lot. So it's almost up and back sometimes. Well, you have to kind of play around with it, but just you got to think about that squeeze there. All right, do you want to do bench first? What's the most common exercise people struggle with or are worried about their shoulder?
I struggle with the bench press.
Bench?
In terms of feeling it in the shoulder.
Yeah. Because it's a big limiter. Like if you can't get the right position, you can't lift heavy enough to then get strength. So it's really important that we get the movement right. Do you want to demo? Main point, I guess, with shoulder health here. I mean, let's go bar. Grip width, for instance. The closer you are, the more triceps you'll get. The further away, the more shoulders will engage. So often, if you've got shoulder pain, further out's harder on your shoulder. But yeah, it doesn't matter that much. It just depends what you want to train. Not yet. But the main thing in terms of protecting shoulder is engaging your shoulder blades. And this is an exercise where you can kind of keep them more fixed because we're not going up here. So it's when you get the bar, engage your shoulder blades and keep it kind of engaging, especially when you start the movement and when you're pushing out again. That engagement. Does everyone think about that when they do it?
Can you show us an example?
That we can do it. We can even do it on the wall. Like if you do a wall push-up, you can get the same movement as a wall push-up. You do a few reps and we'll come back.
This is offensive.
Yeah, well, how about everyone find a wall, or if you're tough, on the ground, and go into a push-up, because you'll get the feeling of the movement straight away. So that squeeze your shoulder blades together, and then come in, and then keep them together as you push out. You should feel your back working really, really hard into a load. So you could do a push-up on the floor, you can do it on the bench. If you struggle with the bench because of range, then we can modify it to like an incline, which funny enough, that's the next slide. So like, yeah, if you struggle on a flat bench, then yeah, you can do incline bench. We can do dumbbell press instead. And this is if you do have shoulder pain, you can't get into that position because you don't have the range, then you can use dumbbells. Well, you want to do it? If Jared's right shoulder is sore that he can't get into that position, then we just bring his elbows in closer so he's not in out of range, and then we can just press from there. Same thing, shoulder blades have to be engaged. Yeah, and then as he gets stronger, he can come back out further. Because the bar's hard because it's stuck in that position. You can't change things up. So sometimes dumbbells is a better alternative to start with. Yeah, cool. Push-up variations. You can do a floor press as well. Because another technique area that we often see is the bar depth. So if your elbow is going below your shoulder, you're putting a lot of compressive load at the front of your shoulder. So you're pulling it out, which is fine. Like some people want to train to that zone. If you've done a lot of it and that's your goal, then you can get to that, and people get really deep. But if you're not used to it, that's just going to annoy your shoulder. So that's where like doing a floor press, I haven't written on that. But if you do it from the floor, you know, you can't go past. So if that's an error that you commonly do, just get on the floor, do it from there. All right, that's the bench. Any questions of the bench? Overhead pressing and overhead are the two most common aggravating positions for the shoulder, which is why I've touched on these two. But it's the same thing. We can do, like you want to squeeze, then engage, like I said, then you've got to kind of let your shoulder blades go, and then engage before you come back down. And you should feel a lot through your shoulder blades. Does anyone want to try? Try after you feel it. But yeah, that's like it's the same sensation as when you're doing that wall press. That's the feeling you should get. Just engage. But yeah, you don't want to either, same as the bench, you don't want your shoulders to go behind, because again, you've got compressive load in the front of your shoulder, so you can modify it by changing the position.
There's another good one is like when you're doing the exercise, just be mindful of what the purpose of the exercise is.
Yeah, exactly. Yeah. Especially like, yeah, it's sometimes hard when you come to a class and you've got things on the, and you're not thinking about that, you're thinking about something else that day.
Yeah, sometimes I'll be like, oh, Christy, what are you thinking about? What for dinner?
Yeah, so like, yeah, you got to one, know the muscle group, like Jared said, and then you'll get a lot out of it. Thoracic mobility is super important here. So if you're really stiff for your back, like if you do these kind of exercises, you get tight all up and down your back, it's probably because your thoracic spine is too stiff. So you can start with some, do you have foam rollers here?
You're on that line.
Yeah, or towels. You'll bring a towel to the gym? Nice, good hygiene. You can roll up the towel and lie over the towel. Again, we'll go through this in a second, but those are really good things to start with if you are prone to having a stiff back. And then yeah, shoulder external rotation is important. We need that range to be able to get overhead. So if you can't, then you need to modify it. Bands are really good for this. Also, you can do a incline press or like a landmine press. I don't know, do you have a landmine? Ignore that. But yeah, banded presses are quite good. You can do it just from here in front. You can stand on them, you can do handles. But I really like, and this is a common rehab one I use for people that have issues with overhead. We're coming in here, we've got to keep our arms parallel, so that's working on our external rotation as well. But then squeezing through the back, and then you're pressing up from there. And you can just start in a mid-range, and then as you get better, you can go overhead. It's really hard.
Yeah, it is.
Like, it's way harder than it looks. Give it a go as well later. But yeah, that's a really good alternative. Do you want to do the row or lat pull down?
Yeah, I think we should, yeah.
Yeah. Kind of engaging the pull. He's pulling here first, see that? And then he's pulling down. If he doesn't engage this and pulls down, see how he's more rounded all the press? Can you feel that?
Yeah.
It'll be a lot more bicep and a lot more through the front of the shoulder. So engage and then pull. It takes a little bit of getting used to if you don't do this.
It sometimes helps lean a fraction back.
Yeah, you just got to be careful if you've got low back issues, you're not overextending. But yeah, definitely lean back a little bit. But once you get this working, you'll find you'll be able to increase weight. You'll be able to lift more because you've got more muscles helping to do the movement. And bigger muscles. And yeah, exactly the same with the row. Engage first, yep, and then pull. And keep it engaged as you come in. Then if you want to work full range, you can let it come a bit further, and then engage again before. Yep, it does become an automatic movement, but to start with, you can break it down, like squeeze, pull, keep squeeze, let it in, then let it go, and then start again. Then as you do it, it will become automatic. It comes down to, again, like, why are we doing the exercises? What are we trying to achieve from the exercise? And then when you're doing the exercise, where am I feeling it? If you're not feeling it in your chest when you're doing it, it's probably, the weight's too heavy. Like I had a patient like a couple of weeks ago, this big gym bloke, huge, and I got him doing a 2 kilo lateral raise, and he couldn't do it. So like when we broke down his movement, he was so weak, but you could, he picked up, big 30 kilo dumbbells, and he's just like lifting, but using everything else in his body. And he came in because he was plateauing. He couldn't lift heavier, and he was just getting hurt. So he broke it right down, and got his base strength there, and then he'll be able to do way better after that. But it's just you saying that, it's so common. People will use every other muscle group just to get the exercise done, but they're actually not benefiting at all from it.
And then as they get older, big problems.
Yeah, I mean the whole reason we exercise is to be able to do what we want to do and live a healthy life and be strong for a long time. And all the research out now about longevity, it's all about kind of muscle mass and how strong we are to support our joints and all those other things. So you've really got to break down the movement to the muscle group that we're trying to achieve, and you'll just get so much more benefit.
Okay.
So you pull down, engage, squeeze your shoulders first, and then you can pull. Do one where you don't engage your shoulders. You see the difference from the back? So right now he's not using these muscles really at all. It's all kind of bicep. So if you squeeze back, now he's engaging lats and all these big muscles. Yeah. Very nice.
But it's not easy to do. And that's why it really helps when we focus on your posture, like chest up, don't round the spine, don't lean back too much, tuck yourself in.
Yeah.
A lot of people won't tuck themselves in. They'll go heel, and then they go heel.
Yeah.
But that does help.
Yeah. Like sometimes if you don't have the mobility, it's hard to get in these positions. Like sometimes you need to work on your mobility first to then be able to do the exercise properly. So if you're struggling, talk to one of the trainers and they'll help you. But some of these maybe mobility exercises we'll go through now might help. So I just put together a really quick 5-minute warm-up. So it's thoracic spine mobility, shoulder mobility, and shoulder strength. Honestly, it's probably less than 5 minutes. If you have a particular issue, then you should do something to address that issue before you start. And I can send this to you guys as well. But thoracic spine mobility is for people that have issues with or stiffness in their thoracic spine, if they've got neck issues or problems with getting overhead. So I often just use a towel. Sometimes I find the foam roller a bit too big. And if you bring a towel already, it's just easy, you can just use your own towel. But we want to do extension and rotation, okay? So extension, right there, I've just got a towel. But you're just working, if you've got a towel, you can just do arms up and over in a certain position. Obviously, if you've got the roller, you can roll forward and back, a few clicks there. But
When was the last time you foam rolled?
a few days. But if you're really stiff and sore, you'll find this is too big and you can't relax over it. And if you can't relax over it, you're not actually getting the benefit. That's where a rolled up towel is really good. You can, if you've got like one like this, you can extend over it that way, which is a bit easier. But yeah, I really like the towel extension. Then we've got your rotation. Wind that up. There's so many different ways you can do a thoracic rotation. I like the bow and arrow. So, like you're shooting a bow and arrow, shoulder blade down towards the floor. You don't want to just bring your arm over, you're just going to stretch your chest. So rotating shoulder blade to the floor, and you should feel that stretch through your back. Other common ones would be like a thread the needle, or sometimes people will do that one. Whatever works really. So yeah, that's the thoracic spine mobility, shoulder mobility. There's Ruby doing a beautiful wall angel.
That's probably one of the hardest ones.
Yeah, that's really, really hard. That's when you want to get end range external rotation. But the trigger ball is a good one. Do you have trigger balls here?
I'll probably have one, but
Yeah, probably good to get a couple. Come on, get some balls for you.
Do you supply them?
Yeah, we can give you some.
Brandon.
But I'll do it mainly through the back of the shoulder here, kind of through there. So this is where your kind of posterior rotator cuff is, the back of your capsule. This is the stuff that gets really tight. And if you're restricted into that external rotation, it's often because this is tight. Like you can solve so many issues just by releasing that off. So all you do is lie on the ball, kind of hold that position. Very painful. If it's too sore on the floor, do it against a wall. If you pretend that's a ball, you like lean up against the wall with the ball in that spot there. You can use a tennis ball. You can use a rock, whatever.
Is there any concern if like your tendons are really inflamed or angry in terms of putting that amount of pressure?
Not really. Like you're pretty safe in that spot. Like that's mainly muscle. Obviously, if it's like that sharp pain, don't push through it. It will be like that muscle release pain. But no, like you don't want to. Your tendons kind of attach here. This common attachment here, so you don't want to be pushing on that. But if you get through the kind of squishy muscle bit there, then it's okay. Yeah, that will make a lot of difference if you've got tightness there. Or the wall angel, if you've got the mobility, that's just a movement exercise. You could even do like, banded up and overs if you've got mobility too. And then we want to get the muscles activated. So I really like this one because we're working in this scaption plane, so the plane of your shoulder blades. We're engaging our shoulder blade muscles and then we're lifting up to about eye level. And you can just repeat that movement. And you should feel that really working through the back. You could also do kind of pull aparts or kind of that shoulder press exercise if you want to work overhead. But this one's probably the best go-to. So you could do all that in, 3 minutes, a minute each. And if you've got shoulder issues, definitely recommend doing that. Obviously don't do it if you saw there's something going on there that you probably need to get addressed, but if it's just general kind of keeping your shoulders at bay, that's a pretty good start. I think that was, that's everything I got. Anyone have any questions? All good?
How often would you do the mobility?
Every time you're going to do,
So before?
yeah. How often do you guys do shoulders? Like in your programming?
No, it's always in the program, so the full body programming, right?
Yeah.
But like, I don't necessarily recommend, it depends on the person, it's like, if you do Monday strength, you choose a cardio, like helps make your days if possible.
Yeah.
But it depends on the individual.
Yeah. So yeah, if it's in every program, do it before every strength. Again, that's just shoulders, like if you've got shoulder problems. If you've got hip or knee or other things, then there's other, like pretty much anything else, activate your glutes. That's your warm up. And that will kind of cover every other problem. But
What's the best way to do that?
your glutes, that's another workshop. You could do,
Well, a lot of the banded exercises we do, like strength as well, but that'll activate all your glutes.
yeah, you could, simply with no equipment, you could just do taps. Like stand on one leg, get the weight on the heel, get the glute working, tapping. You could do a band walk. You could do a single leg bridge. Yeah, you definitely, if you've got hip, low leg problems, back problems, you definitely want to get your glutes working before. But your warm-up set should do that. Should get your glutes working. Unless you've got, if you've got an injury there, when your body is in pain, your body's really good at protecting it. So you get muscle inhibition. So like if you've got low back pain, your brain will tell your glutes to stop working and work as a protector rather than a mover. So then it's hard to get them to work. So then we need to really work on activating them first. And then the pressure will get away from everything else. Same with your shoulder, like your body's like, no, don't do anything there, but you've got to get things working first.
So doing the stretches to warm up, is it worthwhile in terms of to improve your range to actually do stretching like in the evening or first thing in the morning, or will that actually help? Or
The evidence behind stretching now, like, it's not, like you don't have to do it. It's not a permanent change. It's really important that you have full range of motion, but stretching every day won't get you that like permanent fix. You need to be strong through your range.
Right.
But if you are someone who is quite tight, that you need to kind of mobilise before you do your strength work, then it's important.
Mm-hmm.
But yeah, if you did no strength and you only stretched, you're not really getting that much benefit, because we need the muscle around the joint, and we need the muscle through the full range. So yeah, if you can only get to here and you get strong to there, you're not actually helping yourself when you go and do overhead things. So you've got to work on getting that range, and then you get strength through the range. But yeah, like mobility every day is it's not going to hurt you, but you might stretch before you go to bed, and then you wake up and I'm tired again.
Yeah.
So you're probably better off doing like an activation exercise. Yeah, it's funny. It's like stretching is good for so many different things, but yeah, unfortunately, it's a permanent result. Cool. Wrap it up there.
No?
Thank you.
All right.
Thank you.
Well, yeah, no, thanks, guys. Yeah, if you do have issues or questions, just let me know. I can send through. I can send through some of this stuff to you guys in the warm up, if that works, and I can send to you, and you can send it on maybe. I'll put the pain diary and any other tips and things in there.